Good evening, everyone. Thank you all so much for coming. My name is Zach McKinney, and I'm an assistant professor in the Department of Sociology, Criminology, and Human Services. It is my great honor to introduce our Hardy Chair lecturer, Dr. Alicia Suarez. For over 50 years, the Department of Sociology, Criminology, and Human Services has hosted an annual Hardy Chair lecture, bringing distinguished scholars in sociology and criminal justice to engage with our students, faculty, staff, as well as the broader Oneonta community. Past speakers have included such notable figures as Angela Davis, Emmanuel Wallerstein, and Kai Erickson. Before introducing Dr. Suarez, I would like to take just a moment to thank the many people that helped to make this event possible. My deepest gratitude goes to the Office of Academic Affairs, as well as to the Financial Services Department. I want to especially thank Heather Conroe and Shannon Reynolds for their invaluable logistical support. I would also like to thank Chris Spiewak, our Director of Media Services, for his consistently outstanding work managing our technical needs. I am, of course, as always, grateful to my wonderful colleagues in the Department of Sociology, Criminology, and Human Services for their collaboration in organizing tonight's lecture. I'd also like to extend a special thank you to Stephanie Brunetta. Many of you all know Stephanie as our exceptionally capable Director of Communication for Web Services, but she's also something of a Hartwick historian. And it was Stephanie who pointed out to me a very meaningful connection between our institutions, DePauw University and Hartwick College. So Dr. Suarez's appointment as the Otto L. Saunders Professor of Sociology at DePauw University reflects a shared academic legacy. Otto L. Saunders was a longtime member of Hartwick's sociology faculty and later Professor Emeritus. And he also taught at DePauw earlier in his career from 1951 to 1956. So I really think this symbolizes an enduring link between our two institutions. And now, it is my great pleasure to introduce Dr. Alicia Suarez. Dr. Suarez received her BA, MA, and PhD from the University of Indiana at Bloomington. She's been a faculty member in the Department of Sociology and Anthropology at DePauw University since 2008. Her research spans topics such as feminist criminology, the sociology of birth, and harm reduction. And she currently teaches courses in social theory, women's studies, and sexuality, culture, and power. One of the many things that I admire about Dr. Suarez is her deep commitment to social justice. This is reflected both in her scholarship, but as well as in her activism. Professionally, she is involved in the Indiana Midwives Association, and she also serves on the steering committee of the National Viral Hepatitis Roundtable, which is a federal advocacy organization. She also volunteers at the Indiana Women's Prison with the nonprofit Angels Wings, where she works with incarcerated pregnant women and new mothers. Her talk this evening draws on this important work, focusing on her research on incarcerated mothers. And finally, I would like to note that Dr. Suarez's connections to the Hartwick community are both professional and personal. So in addition to the institutional connection to Hartwick through the Otto L. Saunders Professorship, she also taught our very own Dr. Sarasola during his undergraduate years at Pacific Lutheran University. And I also had the privilege of working with Dr. Suarez during my postdoctoral appointment at DePauw University from 2019 to 2021, where she served as my department chair. And I can say firsthand that she led our department through the challenges of the pandemic with remarkable skill and care, and on a more personal note, with great patience for, as our students know, my many own neuroses. So please join me in welcoming Dr. Alicia Suarez.
Hello, everyone. How are y'all? Can y'all hear me okay? I'm pretty loud, so I don't want this to be screaming at you. Thank you for such a sweet introduction. I'd like to thank the university, the college, for inviting me. This is such an honor and such interesting connections. Obviously, I feel old that I've taught one of your professors when he was an undergrad. I'm going to try not to talk too long because no one really wants to hear anyone talk for an hour. And so I'll leave time for Q&A, so I'll just keep checking my phone. I'm not really a slides person. I actually write on the chalkboard when I teach. So I'll try to follow my slides because I get ahead of myself because I'm excited when I talk about my research. So before I move on, I want to just read you some quotes. So these are quotes that are from a recent study that came out from the Prison Policy Initiative. And it's about birth behind bars, but it's for jails. And there's really only one really great book by Dr. Suffren about jail. It's called Jail Care. And it was in the Bay Area, so it's pretty exemplary in terms of she's an anthropologist as well as an MD. But this is a new study, and it looked at media reports of pregnant women who have given birth while in jail, which, if you're not familiar, jail is very different than state prisons. So about 1.5 million women go in and out of jail every year. And some of them are pregnant, right? So what happens? And this research analyzed 35 media reports, which of course is only showing the ones that ended negatively or there are lawsuits involved, but I just wanted to introduce you to this. Of the 35 media reports, 9 babies were stillborn or died. 19 lawsuits emerged from this. So 2/3 of these births occurred in jail cells where the pregnant mother was alone. And 22% of jails nationally have medical facilities, just to give you some context. So my research is about state prison, but just to give you, more people go to jail than state prison, right? And so 24 of these women, of the 35 cases, called for help, and they were ignored. One woman was actually put in solitary because she was screaming, and it was annoying them because she was in pain, because birth is, can be painful. And so, unfortunately, it hasn't led to much change, despite there being all these lawsuits. I will mention a little hopeful news at the end. But I just want to read you some of these quotes, if that's okay, before we get to my slides. So this was a woman in Florida, and she said, "I basically held my baby all night until she died, until she turned blue." So these are women that birthed alone in a jail cell. Another woman in Tennessee gave birth and in a toilet by herself. A woman in Georgia begged for 13 hours to go to the hospital, but birthed in her jail cell, and her baby died 4 days later. In California, a correctional officer stopped at a Starbucks while driving the woman to the hospital, and her baby ended up dying. And then finally, in Louisiana, my home state, a woman gave birth in a toilet, but right before, and excuse my language, this is a direct quote, the jail nurse told her to shut the fuck up and go back to your corner. So these are not atypical experiences. And this is also a global issue. This isn't a domestic issue. So this happens in jails and prisons really around the world. Some countries do better than others. We're not doing real great. So I just wanted to introduce that because these are really recent cases. And has anyone heard of any cases like this ever? Okay, we all need to look at the news. All right. We don't think about pregnant women in jail a lot, right? I mean, we don't really consider that. All right, I'm not used to a clicker. Okay. So I just have a little outline of what I'm going to talk about. So while there is some research, and I'll tell you a little bit more about it, of pregnant women in prison, there's much less research on the relationships between mothers, and some people call them correctional officers, prison officers. I usually call them COs. The women that I interviewed just called them the police. But the journal I published in wanted me to use a certain language. So I'll tell you more again, but a little bit about my methodology. It was a maximum security state prison in the Midwest, and it was actually in an urban area, which is atypical for most state prisons. They're usually more in rural areas, if some of y'all probably know that. And my findings, I'm just giving you a brief overview. COs really, they're gatekeepers in some ways. They're advocates. They also dehumanize women. So it's really complex, the relationships. Because if any of you have ever heard of Irving Goffman, maybe not, a total institution this is a total institution where COs live, well, they don't live there, but they work with women who live there. So there's this very interesting interaction because there has to be some kind of dynamic where it's somewhat reciprocal, right? And so that makes it really complicated. And so what we'll see is that COs can do all these different things at the same time. Maybe like one of your professors writing you up for plagiarism, but then also being really kind to you. Analogy that may work. And then there are some policy implications, which my research is very focused on social change and social justice. So I don't just want to put it out into the 0.002% of people that might read a Sociology Journal article. I want to actually make change. Okay. Most of the research and advocacy work on women in incarceration and health, we know that women who are incarcerated have very extensive histories of trauma. So emotional trauma, sexual trauma, physical trauma, just really high rates of trauma, often substance use. If you know what ACE scores are, adverse childhood events, very high ACE scores. And so that's really typical. So there is research, a lot of research actually on mothering. And, because most women who are incarcerated in state prisons have children that were living with them under 18. So there's a lot of research, especially in the field of social work, about what happens to the children and the dynamics of having an incarcerated mother. But there's less focus on the women. So there's a lot more attention from like human rights organizations, advocacy groups like the Prison Policy Initiative, things like this, than necessarily sociological work. And I'll tell you a little bit more about that. A lot of times they focus on the babies, because who cares about the mothers, right? They suffer double stigma, if you know what that means. So they're already a criminal or offender, which I don't use those words because I find them dehumanizing, but they've committed a crime, they're a woman, and they're pregnant, right? We have the trifecta here. And so there's a lot of judgment towards these women. And so people focus on the babies, right? Researchers, they're like, well, how's the baby doing? And don't really pay attention to the mother because they're a bad person or whatever. There is some research from the field of psychology about mental health effects. It's usually more quantitative work, like standardized surveys, things like this. There hasn't been a ton of qualitative work, which is what I do, which is, if that's not a familiar term to you, I do in-depth interviewing. So that's survey research is considered quantitative statistical. There's some research about opioid use during pregnancy. And some of the women that I talked about, I gave quotes about, were physiologically dependent on opioids, and they were forced into precipitous withdrawal, which is really dangerous for babies. The gold standard is to put them on methadone immediately, very safe for pregnancy, and some of these women didn't receive that. There are some prison nurseries, and interestingly, where I did my research, there's a prison nursery. There's about 11 or 12 in the country. Pretty unusual, complicated. I could talk about that for a long time. I didn't focus on that a lot, but some of the women I interviewed were in the prison nursery. Some focus on the quality of care, like Dr. Suffren, who I mentioned. She's a really esteemed anthropologist and MD, like I said, in the field. And then shackling. So even though the Federal Bureau of Prisons, you're not supposed to shackle, women are still shackled. And at the time of my research, all of the women were shackled during birth. So I doubt, some of you in here have probably given birth, but if you had to have your legs shackled to the bed, this would make birth challenging, to say the least. So we'll go forward. The law has changed in Indiana since then. So in general, we don't know a lot about how these women feel. because people want to focus again on the babies because the babies are the innocents, right? And the women are the bad women. And so I really wanted to know about their experience. Not that I don't care about the babies, but I want to know about the women's experiences. And so there's very little sociological or really any social scientific research on interactions with COs. This is just one paper I have out of this research. I have another one too. So there's lots of different themes that come out of research that you do. So the general literature, and I know some of you are getting credit for being here for your majors and are interested in sociology and criminology. And, you know, as I said before, of course I already repeated myself because I can't follow slides, but there's a lot of discretion involved in the criminal justice system, as many of you probably know, right? So one of the women once told me the only thing that's consistent is inconsistency. And so women are often construed as the enemy. And in fact, a lot of COs that I've talked to prefer to work in men's prisons because they see women as emotional and catty and gamey, which is very gendered and interesting. And so, you know, there's not a lot of emotional training for correctional officers. It's usually you just have to have a high school degree. I have a student right now in my intro class who is a correctional officer. I think she's 19. So, and maybe there's some of you out here. You don't have to have a special training to be a CO. So, prisons are generally set up for men and have always been, which is difficult when you're talking about pregnant people. So, how did I get in here? It's not very easy to be a sociologist who does research in a prison, much less with pregnant people, okay? This is really hard to do. And so, as Dr. McKinney said, I volunteered there. I don't anymore. The program shut down during COVID and hasn't been, restarted. But I volunteered with a group called Angels Wings, and we did showers for the women, like baby showers, even though some of them were postpartum because they were just quarterly. But it was just a way to try to normalize it. And like we do little games, like try to change a diaper with one hand, and you know what I mean? Like put celebrity baby pictures and try to make it fun and normal, right? Because there's nothing normal about being pregnant in prison, or and this is again a state prison, maximum security. I also, when I was on sabbatical, taught a course there, which of course I wasn't paid for, and I had to crowdsource money for their books. So they don't have access to the internet. It was quite interesting. I've taught for 25 years, and it was maybe the most impactful experience I've had. Needless to say, I was known at the prison, right? So it wasn't super hard for me at that point to gain rapport. And especially, I'll talk about it in a little bit, but I see I'm getting ahead of myself. I apologize. But all pregnant people in Indiana are sent to this prison. Because it's in an urban area, so it's closer to, well, interestingly, the hospital at the time that won the contract was an hour away. But women with low-risk pregnancies, which I won't bother explaining that to you, they were seen by nurse midwives at the prison who came to the prison from the hospital. And then they birthed at this hospital, which was an hour away. So a lot of times they induced labor because they didn't want it to be a precipitous, fast birth, because then they would have to go to a hospital that was in the city, and it would cost more. So, and prison healthcare is very interesting. I don't know if there's any classes about that here, but there's a lot of lawsuits, if you want to look up some of them. So who did I research? And someone asked me this in a class earlier that I spoke at today. Basically anyone who would talk to me. You can't do like a random sample or purposive sampling in this kind of setting. So I was able to interview 18 women. This is in 2016. Only 2 of them were pregnant at the time. Most of them were postpartum, but they were less than 3 months. So it was, recent. Let's see, the average age was 29. 67% had been previously incarcerated, which isn't surprising considering recidivism rates, repeat incarceration. And 78% were white and 22% were women of color, which actually reflects the population of Indiana, because we know that people are disproportionately incarcerated by race and ethnicity, but this reflects our state population there. Most of the women identified as heterosexual and Christian. About half of them were in a cohabiting or marital relationship at the time, and over half had taken some college courses, because at the time we had a really good college program at the prison. So how did I get in, right? How was I able to do this research? Part of it, as I said, I'd done volunteer work, I taught a course, and then obviously my appearance facilitated rapport, right? I don't look like a stuffy academic. And I'm very familiar with drug culture because of my work in harm reduction. Most of my friends have done time in prison, so they trusted me. They were like, "You're not with the police." And I'm like, "No, I'm not." No offense to any future law enforcement, but there's a lot of skepticism of women in prison, of anyone wanting to talk to them, because they're interrogated constantly about everything, especially when they're entering. They have to say the same thing over and over and over and over about their histories. And so that wasn't as much of an issue for me to be able to get in. Now, in terms of other issues with research methodology I could talk about there, especially with me like going into the prison, I was stopped several times because I didn't have on the right clothes, or I was supposed to take out my piercing. And so I was treated just like any visitor. Like, it didn't matter that I was a researcher. Like, nobody cared. You know, I was yelled at in the visiting room. I mean, so that was interesting. So let's get to my findings. So most of the COs, as I said before, it's very complex, right? As we all are, we're all multifaceted, right? And some of them, most of them who dealt with any of the pregnant women, which could be anyone, it could be men who are COs, it could be women, they're left to determine who should be sent to the infirmary. And so a lot of times in prison settings, especially with women, they're seen as like malingerers or complaining, right, and not believed. Like, oh, you just want to go to the infirmary to get out of here for a little bit. So there's a lot of hesitancy on the point of COs to be like, you don't need to go. You don't need to go to the infirmary. You're fine. You're fine. So correctional officers are not trained to recognize labor. Why would they be, right? They're not midwives. They're not obstetricians. We shouldn't expect that of correctional officers. But nonetheless, they were left to determine whether the woman should be sent to the infirmary. So I find that problematic. Maybe you do as well. But it was very indeterminate in terms of who was working on different shifts, on what rules were allowed. So there was a lot of mundane rules. Like during count, you're not supposed to go to the bathroom. Do y'all know what count is? So when you're in prison at different times of day, you have to do count, and like you have to kind of line up, at least at most maximum security. And some of the COs would be like, if you're pregnant, sometimes you have to urinate a lot when there's pressure on the bladder. And some COs would be like, you can go to the bathroom, and then other ones would write them up when the night before they'd been allowed to go. So, and they had these pregnancy sacks, which almost every woman complained about them, and I could talk about that later, because it was, and some of the COs allowed them to have their pregnancy sack. This just means to get extra calories, right? You need to eat more when you're pregnant. So they were given some food, and some of the COs let them eat it after 9 p.m., some didn't. Most importantly, women had to literally prove they were in labor. So as you can see the quote, I'll read it out loud. These are all pseudonyms. Haley chose to not flush her mucus plug. If you don't know what that means, I can explain birth later. But anyways, it's a sign of labor beginning, down the toilet. And she chose not to. So I'm like showing the guard. It seems like nobody believes anything around here. So it was like, look, witness. And then another woman, I'm going to read you this quote. she had a similar experience. This was Susan. She was in labor with her 7th child, so she definitely was familiar with pregnancy and birth. And she said, when I started gushing blood, I'd wiped and flushed the toilet before I called the officer. And she was like, you're not supposed to flush the toilet. You're supposed to let me see that you're bleeding all the blood. So I think they thought I was like faking it. So I'm just sitting there like bleeding all over myself for an hour waiting to go to the hospital. So this is not an atypical experience. Yet they were also advocates at the same time. And these could be the same officers, right? I mean, could be their mood, could be whether they didn't like that particular person, or they had a beef about something, you know what I mean? And we all change day to day, right? Whether someone annoys us or not. And so Haley described how she felt so bad for me because I was walking and having contractions, and finally she just came in my room with a wheelchair. She's like, I called up there to the infirmary, you're in pain. And so she was brought to the infirmary, though a lot of women are told, you're not really in labor, right? Which, if you ever have a baby, you kind of know when you're in labor. So, but it was left to someone else to determine that. On the other hand, some of the COs verbally shamed the women, not only on the unit, but at the hospital as well. And I'll give you some examples. So a lot of times, so they always had a man CO outside the room who was armed. There was no family or friends allowed. And why they induced the pregnancy a lot. Do y'all know what that means, induced? Okay, if you don't, I'll explain it later if you want. So that they couldn't call family or friends and like, I'm going to the hospital, because they were considered a flight risk. So a woman who's 9 months pregnant and is like waddling around, you're not a flight risk when you're in hard labor. You're not gonna run, okay? I promise. But that was a way to so that they couldn't escape. Also, that's the reasoning for the shackling, so that they couldn't run away. But anyway, so it was always a woman CO in the room with them. And Susan talks about, she had a C-section, and upon first going to the bathroom, Susan described the following. I was trying to pull my pants down in the bathroom, and all of a sudden pee and blood just goes everywhere, and I couldn't get my pants off because of the handcuff. She means the shackle on her leg. So this is after birth. So you're only unshackled when you're in pushing. And the COs have to call and get permission from the prison for the shackle to be removed. And sometimes, anyways, I could talk a lot more about that. But she said, I pressed the help button, the nurse had to come in there and help me, and then one of the guards had to come in there and get the handcuffs off, and she's saying like, this is fucking nasty, this is so gross, and I was like, I can't help it. A lot of the women cried during their interviews with me, obviously. Some other things that happened at the hospital was a lack of privacy, because remember, that's the only person in the room with them, was a woman correctional officer. No family and friends, no support, nothing. And some of the women talked about like that some of the COs felt it was like a vacation, and they would like control the TV and order like food. And usually at a hospital, when you're in labor, they don't let you eat. Almost never at the hospital. So the COs would be like eating there, and they'd be like, I'm hungry, you know? And and then some of the mothers talked about the lack of acknowledgement that this woman is laboring alone and afraid, you know? So Lydia said she, the CO, just complained the whole time about everything. And I'm all thinking to myself, is just like, shut up. And I'm mentally trying to prepare for pushing. I don't think I have it on my next slide, but no, let me go back. Other said they talked too much and were being too chatty, but not about the labor, just like about mundane things. And then others were like, can you see that I'm in labor? Right? So it vacillated, right? And some women wanted attention, some mothers did, some didn't. It was variable. At the same time, even some of the same officers were compassionate and supportive, which is why the title of the paper is, I Wish I Could Hold Your Hand. And so almost all of the women said they're different at the hospital. which is a really interesting thing to think about, right? Even at the same time as the previous slide I showed, where the woman was like, this is disgusting, this is gross, but a minute later they could be more compassionate. And again, this is rare in qualitative research when you hear literally the same phrase over and over, and they said, like, I'm really lucky, you know, I got lucky with her, she was really nice. So Lydia recounted, yes, she was horrible in the dorms, but she's worked here for 20 some odd years. She's not gonna play with you at the hospital. Like, she was amazing. That sounds pretty good, right? They couldn't offer labor support, of course, right? That's not their job, it shouldn't be their job. And Chris told me, the one that asked told me, I wish I could hold your hand, but she wasn't allowed to. And so she's the one that said, maybe you should get the epidural, which an epidural is pain relief for the spine. And if your leg is shackled, it'd be really hard to have an unmedicated birth, in my opinion. So some actually did help the women and violated prison rules. So Susan said, she's like kind of a little grandma, like she's a little white lady. They had the bassinet beside the bed, and because of my C-section, I couldn't like put her all the way down in the bassinet because I had to lift her over. She's like, oh yeah, I'll come get her for you. And they were not supposed to touch the babies, the correctional officers. But a C-section is a major abdominal surgery, and so to sit up or do anything is very challenging and hurts. So it's almost logistically impossible, you know. And so this woman helped. Actually, I have another example that I'll tell you about. This is just from my memory. There was a woman whose baby was in the NICU, and the officer kept calling the prison superintendent and stuff to try to allow her permission to get to the NICU, and a lot of bureaucracy, and she basically just let her sneak down there several times, and she got written up, the CO did. So I'm just giving you examples about the complexity of the relationships with all of this. And most of these women were not involved in the prison nursery. So what that means is their baby was going to leave from the hospital, be picked up from the hospital. So most of them actually wanted a C-section, cesarean, because they got 48 hours with the baby, and if they had a vaginal birth, they got 24. So most of them were totally cool with getting a C-section, because then they'd have 2 days. Very few women, the nursery held like 12 women, and it was very strict rules about who could be in there. 2 of the women I interviewed, their babies got kicked out. Like, it's really easy to get to not be able to stay in the nursery. I can talk about that later. So, what are we gonna do about this, if you care? One of the things is trauma-informed care. And to quote Benedict, this is to offer justice-involved women opportunities to experience safety, trust, choice, collaboration, and empowerment. Trauma-informed care for all prison staff, as many women, as I mentioned before, have experienced lots of trauma. For women who have had sexual violence, birth can be very re-traumatizing because there's people who are looking at your vulva in between your legs and often doing things without even telling you what they're doing. And if it's a teaching hospital, there's residents, and no one's telling you, you'll have 6 people in between your legs, right? So if you've had sexualized violence, it can be re-traumatizing, and most of these women had. So I suggest that future research should explore this. How are we gonna pay, and who's gonna pay for trauma-informed care for correctional officers? I don't know, right? It'd have to be a pretty specific state Department of Corrections that would choose to invest that kind of money in training for entry-level jobs, you know? As I say below, this could really help correctional officers. They're put into a bind, right? A lot of these correctional officers have compassion. I wish I could hold your hand, right? They should not have to be in this position to be present at a woman's birth. This is not part of the job protocol, right? I know several of you want to go into law enforcement, and I doubt you want to be an attendant at a woman's birth. Do you? I don't think you do, unless you want to be a midwife or, you know, I mean, I don't think that's what you're in here for. So these are some suggestions. Also, prison doula programs. which is an amazing one in Milwaukee, through Milwaukee jails. So a doula is labor support. They are not a medical provider. They just support women who are in labor. And there's a lot of like prison doula programs, and it's all volunteer work for doulas. And some prisons aren't very friendly to doula programs. The prison that I worked at, did research at, they wouldn't allow it. But birthing alone would be, I've never experienced birthing alone. What I would imagine it would be very embarrassing, shameful, and just horrible, to be honest. Birth is a very, one of the most, in my opinion, like intense moments of someone's life if they choose to have a baby. So birth doulas could provide emotional and physical support, which would improve birth outcomes. It'd lead to higher satisfaction rates for mothers and staff, right? Because then the staff, I mean, they could stand outside the door, but they didn't have to be in there, right? Unless they wanted to watch TV and control the temperature and stuff like that and order food. But it would also like lower program cost, which is, again, those of y'all who heard me talk in class earlier, when people don't care about humans, I just get to the fiscal point. Like, don't you want to save money? Right? You can not care about these mothers because they're bad women, but this will save you money. So a prison doula program, but again, then you have to have find volunteers. So I want to make sure to acknowledge these women who shared their stories with me, because I wouldn't be able to share this knowledge with you, and I'm really centering their voices. I was very humbled to be invited to present my research at the State House. Several of these women, post-release, they did it. They wrote legislation, got sponsors, and there was no longer a shackling bill. There's no longer, it's illegal to shackle in the state of Indiana now. And this was led by those women. This wasn't led by an academic. This wasn't led by some politician. I mean, they had to get political support, right? But they asked me. I wasn't like, let's go do this, because that's not my place, right? So, but when they asked me, I was very honored. And one of the officials from the DOC, from the Department of Corrections, said, well, I don't believe that these women were shackled. I need the names of the people involved. And I almost started laughing, but I controlled myself and was like, I have an NIH certificate of confidentiality. You can't subpoena my data, thanks. But all the women are shackled, you know? So, and it still happens even when it's basically discretion. Like if they don't like the woman or if they think the woman's being bitchy or something, they'll shackle them. So, and some officers have had to, like, actually doctors have had to just say, like, force the COs, like, take the shackle off now, because the officer can't get through to the prison, you know, bureaucracy. So, anyways, that's about it. I tried to wrap it up pretty quickly, even though I guess I talked for 40 minutes, 45 minutes, so hopefully y'all were entertained enough. Thank you for coming, and I'm happy to answer any and all questions.
Yeah. Did you notice any differences in care based on like the woman's age, race, or sentence length?
I did in Brick, I think it was 77% roughly of, I'm pretty loud anyway, but I can use the mic for the video, were white, just because of the state where I live. What I did notice, what they told me, is what their charge was. So like one woman was like, oh, once she realized I wasn't in on a dope charge and it was burglary, then she was cool. Because a pregnant mother who used drugs, I mean, let's add like a fourth layer of stigma, right? So that was one thing I noticed. I also, a limitation is I didn't interview correctional officers. This is just from the women's perspective. And I will just add, the providers at the hospital where they were birthing at the time were fabulous. None of them complained. I mean, I could write another paper about that. They were all, like, they treated us well, they respected us. So their interactions with healthcare staff was actually really positive.
So you said that, well, first you gave examples about how, like, the correctional officers would say, like, kind of, like, rude, like, stigmatizing things against them. And then they would be like, oh, but they were so nice. I was so lucky. So do you think that reflects how they were being treated in the prisons to be considering that lucky?
Yeah. When you're being dehumanized consistently, if someone offers you some modicum of civility and respect, it is seen as nice. Yeah. So, yeah. And again, it's different, right? It depends how long they work there. We're all in different moods at times. But, I mean, they're called offenders, right? I mean, to me, that's a very stigmatizing word. They'll be like, offender Smith, or whatever, and I'm like, she's Paula, or what, what are you talking about? Like, so I don't use that word. I don't use offenders or prisoners. I'll see people who are incarcerated. So that's just an example. I think another question next. I'm gonna let you do this. You're more on top of it.
I was curious as like what they would do with the children after the birth and all that stuff, like where they go, yeah.
So actually, most of the children went with a family member or a friend. Those who weren't allowed in the prison nursery, which most of them were not, and very few went into social services. But like I know one woman I remember very clearly, her friend that she worked with at a motel took her baby. It obviously depends on family relationships. A lot of grandmas took babies. But as I said, a lot of the women in this research were partnered. So sometimes their dads would take babies, but then I remember one woman talking about like, he's nodding out on dope all the time and he has the baby. And I'm worried, there's like roaches in the house and all this stuff. There was also, interestingly, an Amish community that would take pregnant women's babies. And so they'd be raised in the Amish community. We have, y'all don't have many Amish folks here, do you? Some? Okay, well, we didn't have them in Louisiana where I'm from. When I moved to Indiana and saw like buggies, I was like, whoa. But so there was an organization and they would raise the children, and then when the women would get out, they could get their baby back. Not a lot of them wanted that, but sometimes it was their only choice besides like going into social services. Yeah. Oh, you got it. All right.
This is kind of like two questions, but how did recidivism for like incarcerated persons affect their treatment by the COs, and how did like the gender, I guess, of the correctional officers kind of affect their treatment of the incarcerated people?
Yeah, that's a good question. So the research on COs is often that even if they're women, they tend to have to perform masculinity more in terms of, because prison is an androcentric institution. So women COs tend to, that's typical in any male-dominated field, occupation, regardless of what it is. You have to perform masculinity so that, because we live in a patriarchal society. So in terms of recidivism, that is not something that was brought up a lot, but two of the women that I interviewed had previously given birth in prison. So I'm sure they were judged extra hard as being like doubly, triply, quadruply bad mothers, right? And the mothers who used drugs or were in for drug charges, which a lot of them were definitely treated really poorly because they were, how could you do that? How could you use drugs while you were pregnant? Some of the women didn't know they were pregnant, so.
Hi. I have a question on how like postpartum care was taken care of after like birth happened, obviously, but like how was it handled like the COs and the women who were still incarcerated?
Not well. So again, a C-section is a major abdominal surgery. It's, if any of you, your abdomen, your core is real important, okay? If you cough or laugh or try to sit up, it's going to hurt. And they were sent home, they were given Tylenol. And they were given like a week or two off of like whatever their prison job was. But they didn't really receive special care. They just went back to their cell. And sometimes their bunkies would kind of like want to celebrate them, and some women liked that and some women didn't, because they don't want to be, most of the women didn't, I mean, very few women were in the nursery. So some of them were like, I didn't like that my bunkie was making a big deal about it and trying to be nice to me. I just wanted to, and then others felt it was really kind. So, Rose?
Have you found any cases of women coming in not pregnant and then giving birth?
None of the women I researched, could y'all hear that, the question? None of the women I researched said that something is, that's why the Korea asked this. But I have found stories about that, since actually a lot of the women are charged with Korea, Prison Rape Elimination Act. Because that's a whole other story. But no, none of the women that I interviewed, they were pregnant on it.
I'm kind of curious if you got a sense, because you said not many women made it into the prison nursery. Did you get a sense in your interviews of, I'm going to say, conflict between women who did get in versus women who were not able to?
100%. That's a great question, too. I mean, all of your questions were great. I should have said that after everyone's question. They had to do prenatal classes, even though some of them were postpartum. And I sat in on one. I was allowed to sit in on one. And it was like so inapplicable to women who are incarcerated. Like, most of them aren't going to have their newborn. It was like newborn care, nutrition while you're pregnant. And it's like, what are you talking about? The food isn't even, it's like not even real meat or whatever. And so they just thought it was a joke. And there was definitely conflict between women who were in the prison nursery program, because you could go in once you were pregnant versus those who weren't. Yeah, the ones who weren't allowed in the nursery talked smack about a lot of, and vice versa. So yeah, there was definitely conflict. Yeah. Oh, you got it? Yeah, I mean, I can get some steps in. Yeah, yeah, thanks, Zach.
Can you speak more about the pregnancy sex? The
Sex.
sex?
Oh, I thought you said sex. I was like, well, there was probably a penis and a vagina involved. Nearly all the women told me they got grapefruit in their pregnancy sac. And a lot of women have heartburn when they're pregnant. I had terrible heartburn. And as you know, grapefruit is very acidic. And they almost all said, and it wasn't ruby red. I mean, and then they get peanut butter sandwiches, and they also made sure to explain that it was natural peanut butter that had no sugar or salt. So they weren't particularly happy with their pregnancy sacs. Yeah, it was just like a bag that they got. It was like a snack, like a little extra thing you got. It's just to meet the legal caloric content. A lot of women got gestational diabetes because of the food at the prison. Not a lot of vegetables or fruit, and really high carb content. So gestational diabetes can be pretty serious, or preeclampsia, which I won't bore you with all that. But there was a lot of institutional induced problems, if that makes sense. So yeah, not ruby red. So, but like grapefruit's the worst. I can't imagine when you have heartburn eating a grapefruit.
So I'm curious, you spoke on how we're not quite doing this in the best way possible. There are countries that are doing better. I'm curious about some of those better practices that you have observed within your research, as well as speaking with other colleagues, what those best practices that you have observed are.
Yeah. Colorado is actually doing pretty good. There was a lawsuit, and they passed and changed a law, and basically pregnant women are no longer being incarcerated in a facility. They're having alternative sentences, so like community-based corrections and stuff like that. So, and different countries allow children to live with their mothers until they're 5 in prison nurseries, and they're much more common. My research was actually included in a metasynthesis. I'm not going to get into explaining what that is. And one of their critiques was that what my proposal and most other research, there's not a lot of sociological stuff, but psychology and public health, is that we're just suggesting Band-Aids, which is true, right? They're like, we need to abolish the carceral system, much less for pregnant women. So that would ultimately be the solution, right? I don't see prison abolition happening anytime soon in this country. And because of the stigma towards women who commit crime, because we're not supposed to commit crime, we're not supposed to be mothers, and we're not supposed to get pregnant and go to prison. So there's really not a lot of sympathy or attention to this issue, because people are like, they deserved it, but let's care about the baby, but nobody cares about the mother. So, I mean, that's kind of dismal. But Colorado has had some success, and after a lawsuit in Florida, they've made some changes. I mean, at least we're not shackling people in some states anymore. Sorry, I wish I had a more hopeful answer for you there. You had your hand up, right? Oh, do your thing, girl. Yeah, I'm sorry, I'm like...
So like, if women weren't getting like proper care in like while they were incarcerated while being pregnant, did any of the babies have like complications like malnutrition or anything like that?
Not at the prison where I was studying, because they did have prenatal care and regular prenatal care through the certified nurse midwives. But basically, medical care is in prisons is contracted. It's like who puts in the lowest bid. Corizon, I think is one. Is that Corizon? I think is the name of one of the health institutions. If you look it up, you can see the number of lawsuits. But so they got decent prenatal care, but the fact that they were induced is unnecessary, but it was so that they couldn't, make a run for it. But none of these babies really, though in what I was quoting earlier, jail is often different, and I can't speak to other prisons. My research is not generalizable because it's not quantitative. So, excuse me, but based on my readings and familiarity with the literature, it's probably pretty similar in other state prisons. I need to drink some water. Okay. You're all done. Is your attention span over? You have a question? Oh, okay. No, it's just talking. My throat gets dry.
You mentioned that your research doesn't necessarily get a lot of attention because it's academic and not a lot of people are going out and looking for things like that. What's your opinion on shows like Orange is the New Black? I don't mean to like.
No, that's a great question.
But there are certain things that are portrayed there that I am learning here are maybe more extreme that they can't really show. So I just want to know what your opinion is on it.
I taught a January term. I know y'all have January term. We call it winter term. And I taught one called Is Orange the New Black? And it was when it was really popular. We watched the first season, and then we read Piper Kerman's book, and then we compared it to actual literature. It's Hollywood. You know what I mean? Some of it's accurate. A lot of it's not. There's not nearly that much sex going on, as in Orange is the New Black, or they'd be sent to solitary because they're a long story. But Piper Kerman actually came to DePauw once. It must be really nice to be a white woman who has a felony and make a ton of money for giving talks at colleges. That's all I have to say.
I think we have time for maybe one more question, if anyone has one.
I remember before you were speaking about how some women had their their kids die, and you said that you were gonna follow up on what happened with that, or I want to know maybe how the prison handled the deaths, or either I know you said there was some good news about it.
Yeah, so that was not, that sounds a lot. That was actually not my research, that was in jails. So outcomes in jails are typically, except in the Bay Area with Dr. Suffren's research, because they work with the San Francisco Public Health Department, jails are really not equipped to give birth in. nor state prisons generally. So that's not my research, but I can tell you the name of the research. They looked at media accounts. So there's a lot of lawsuits and this happens all the time, where women in jails are like, I'm in labor, and they're told to shut the F up, you're not, and they birth alone, on a cot by themselves. And a lot of those babies have poor health, mortality and morbidity issues. So, but yeah, we don't talk about this. We don't think about pregnant women in prison or jail. I mean, it's just not something that's on our minds, really. So, it's 6 o'clock, and I know y'all are probably ready to go, but I am here to answer questions if you would like to. Thank you for coming, and I hope you learned something new.
Dr. Suarez, I speak for all of us in saying thank you so much.